Question number 3, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by his statement that, quote, only National can deliver more services while reducing District Health Board deficits, end quote?
The Honourable Peseta Sam Lotu-Iiga.
Thank you, Mr Speaker. Yes, because in 2008 the deficits were $155 million and growing, and they are now reduced to $66 million per year. And these are forecast to be less this year. In respect to whether only National can deliver more services, absolutely. Under National, there are 110,000 more specialist assessments a year, and under that member's watch, where she increased the budget by $3 billion, they were 7,000 less during her reign.
Supplementary question, the Honourable Annette King.
Why does he continue to make that claim that only National can provide more services when Oamaru Hospital is being forced to reduce their bed numbers by 20% to meet a predicted 10% funding cut? At the same time, demand for services have almost doubled on what they're funded for.
The Honourable Peseta Sam Lotu-Iiga.
Well, I continue on behalf of the Minister to assert that because it is true.
Order.
Supplementary
question, the Honourable Annette King.
Is he going to ignore the warning from the New Zealand Medical Association Chair, Dr Stephen Child, who said the increasing pressure being put on the Oamaru community could have serious implications for quality of care, increasing burnout, decreasing job satisfaction and increasing staff turnover?
The Honourable Peseta Sam Lotu-Iiga.
Mr Speaker, no, it's not true, because the health budget has increased by $4 billion since this National Government took office. Electives have increased by 50,000 more under this National Government, and increased special assessments, as I've already said, have gone up by 110,000 per year.
Supplementary question, the Honourable Annette King.
If there are more services and funding, why did Dr Stephen Child, Chair of the New Zealand Medical Association, say the funding issues faced at Oamaru Hospital are, quote, a microcosm of the healthcare system at large, end quote, which, as most thinking people know, is underfunded by $1.7 billion?
The Honourable Peseta Sam Lotu-Iiga.
Mr Speaker, as I've already said, the budget for health has gone up by $4 billion. And I'm answering the question, and that member knows that health services are a lot more effective and a lot more efficient under this National Government.
Supplementary question, Mr Speaker.
Order.
Is the way...
Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. Is the way to provide more services and reduce deficits to serve up inedible hospital food like the slop served to a woman after giving birth at Dunedin Hospital under the government's flawed hospital plan? You're right. What is it? What is it?
Order.
Order.
The question's been asked. The Honourable Peseta Sam Lotu-Iiga.
I didn't catch the last part of that question, Mr Speaker. Can she just...
Order. On the basis that the Minister has not caught the full part of the question, I invite the Minister to other member to ask it again.
Thank you, Mr Speaker. Is the way to provide more services and reduce deficits to serve up inedible hospital food like these slops served to a woman after she gave birth at Dunedin Hospital under the government's flawed hospital food plan?
The Honourable Peseta Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, that member knows that the quality of DHB food is a matter for the district health boards themselves. There are nutritional standards that still have to be met, and at Southern District Health Board, as that member knows, there has been an increase of over $134 million since this National Government took office.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
When he said the new hospital food plan would provide food with nutritional value, is an example of his claim this wet, soggy, empty pastry case served on a dollop of spud given recently to a patient under the new improved food policy his government approved? Yeah,
Order.
Jerry, you might like
Order.
it, Jerry.
Order. 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 Can I just remind the Honourable Annette King, when I rise to my feet, that's the time to stop interjecting. I know the member was responding, but then to sit down. And equally, can I remind people to the right-hand side, again, when I rise to my feet, interjections proceed. The answer, the Honourable Peseta Sam Lotu-Iiga.
Thank you, Mr Speaker. I'll reiterate for that member, because she didn't understand the last answer. The quality of DH food is a matter for district health boards. There is some good food, and there is some not so, shall we say, nutritional food, but they meet the standards, the nutritional standards that are prescribed.
Question.